A 40-year-old man has a lifelong history of dark urine that turns black upon standing, along with progressive arthritis of the spine and large joints, and dark discoloration of the ear cartilage. Which enzyme deficiency causes this condition? A is homogenisate oxidase, B phenylalanine hydroxylase, C tyrosinase, D fumarylacetoacetate hydrolase undefined cystathionine synthase. The correct answer is homogenisate oxidase. Alkaptonuria results from homogenisate oxidase deficiency in the tyrosine degradation pathway, causing accumulation of homogenisate acid, which oxidizes and polymerizes to a dark pigment on standing urine and deposits in cartilage and connective tissue aponeurosis, producing dark ear cartilage and early degenerative arthritis. It is a generally benign condition aside from the joint and cartilage effects. A 22-year-old man is brought to the emergency department after collapsing at a nightclub. He is agitated, diaphoretic, and has dilated pupils. Vital signs show blood pressures 178 D, 1.4 mm, Hg, heart rate 132 min, and temperature 38.9 C. He reports snorting a white powder an hour earlier. Which of the following is the most likely coercive substance? A. Cocaine, B. Diazepam, C. Heroin, D. Marijuana undefined phencyclidine. The correct answer is cocaine. Sympathomimetic toxicity with hypertension, tachycardia, major varices, hypothermia, and agitation following nasal insufflation of a white powder is classic for acute cocaine intoxication, which blocks dopamine, norepinephrine, and serotonin reuptake. A 24-year-old man is stung by a bee and within minutes develops facial swelling, urticaria, wheezing, and hypotension. Which of the following best describes the immunologic mechanism underlying this reaction? A. Performed bound to mast cells crosslinks with antigen, triggering degranulation of histamine and other mediators. B. Antigen-antibody immune complexes deposit in vessel walls, activating complement. C. Cytotoxic T cells directly destroy antigen-bearing cells. D. Antibodies form against cell surface antigens, activating complement-mediated lyses. Undefined sensitized T cells release cytokines 48-72 hours after antigen exposure. The correct answer is performed bound to mast cells crosslinks with antigen, triggering degranulation of histamine and other mediators. Anaphylaxis to a bee sting is a type I hypersensitivity reaction in which antigen crosslinks performed already bound to mast cells and basophils, triggering rapid degranulation of histamine and other vasoactive mediators, producing the immediate urticaria, angioedema, and hypotension seen here. Type 4 hypersensitivity, in contrast, is T-cell mediated and delayed T8-72 hours, which does not match this rapid onset presentation. A patient with a history of long QT syndrome is prescribed a macrolide antibiotic and subsequently develops torsades de pointes. Which class of antiarrhythmic drugs shares the greatest risk of QT prolongation and torsades de pointes? A class e.g. lidocaine, B class Roman 3 e.g. sotalol, C class Road 2 e.g. metoprolol, D class 4 e.g. diltiazem, undefined class IR e.g. quinidine only, with no class 4-3 risk. The correct answer is class Roman 3 Fiji, sotalol. Class Roman 3 antiarrhythmics like sotalol block potassium channels, prolonging the QT interval and increasing the risk of torsades de pointes, especially when combined with other QT prolonging drugs. Class IR drugs such as quinidine also prolong QT, but class 4-3 agents carry the most consistent and pronounced risk. A 60-year-old woman who has taken alprazolam daily for 15 years abruptly stops due to running out of her prescription. 2 days later, she presents with tremor, anxiety, tachycardia, and a witnessed generalized tonic-clonic seizure. Which of the following is the most important consideration regarding this withdrawal syndrome? A, it can be life-threatening and requires a gradual taper or cross-titration with a longer-acting benzodiazepine. B, that is self-limited and requires no intervention. C, that is treated definitively with naloxone. D, that typically resolves within 6 hours without treatment. Undefined, it warrants immediate initiation of disulfiram. The correct answer is it can be life-threatening and requires a gradual taper or cross-titration with a longer-acting benzodiazepine. Like alcohol withdrawal, abrupt cessation of chronic benzodiazepine use can cause seizures and is potentially fatal. Management involves slow tapering, often after cross-titrating to a longer-acting agent such as diazepam or clonazepam, rather than abrupt discontinuation. During a routine visit, a 34-year-old man tells his physician that he has been having recurrent, detailed thoughts of shooting his ex-wife and has purchased a firearm for this purpose. Which of the following is the most appropriate action? A, warn the ex-wife and notify appropriate authorities. B, maintain confidentiality since this was disclosed during treatment. C, refer the patient to psychotherapy and take no further action. D, ask the patient to voluntarily surrender the firearm with no other action. Undefined, document the statement but continue without disclosure. The correct answer is warn the ex-wife and notify appropriate authorities. The Tarasoff duty to protect overrides confidentiality when a patient poses a specific, credible, and serious threat to an identifiable third party, obligating the physician to warn the intended victim and notify authorities. Simply referring for therapy or documenting without action fails to meet this legal and ethical duty to protect. A 50-year-old woman with alcohol use disorder presents confused, with nystagmus and an ataxic gait. Which of the following is the most appropriate immediate treatment prior to administering any glucose-containing fluids? A, fluormine. B, dextrose 50. C, oral folate. D, for naloxone. Undefined. For magnesium sulfate. The correct answer is bromide-4-thiamine. The triad of confusion, ataxia, and ophthalmoplegia nystagmus suggests wernic encephalopathy. Thiamine should be administered before or with glucose because giving glucose first can precipitate or worsen wernic encephalopathy in a thiamine-deficient patient. A patient taking a statin for hypercholesterolemia is educated about its mechanism of action. Which enzyme does this drug class inhibit to reduce endogenous cholesterol synthesis? A, HMG-CoA reductase. B, squalene epoxidase. C, acetyl-CoA carboxylase. D, HMG-CoA synthase. Undefined. Cholesterol 7-alpha hydroxylase. The correct answer is HMG-CoA reductase. Statins competitively inhibit HMG-CoA reductase, the rate-limiting enzyme of the cholesterol synthesis pathway that converts HMG-CoA to mevalonate, thereby lowering intracellular cholesterol and upregulating LDL receptor expression to further clear circulating LDL. The other enzymes listed participate in cholesterol synthesis or bile acid metabolism, but are not the pharmacologic target of statins. A healthy 25-year-old woman with no history of abnormal pap smears asks how often she should be screened for cervical cancer. What is the appropriate recommendation for average risk women in this age group? A, annual pap smear alone. B, pap smear cytology alone every 3 years. C, co-testing with pap smear and HPV testing every year. D, no screening needed until age 30. The correct answer is pap smear cytology alone every 3 years. For average risk women aged 21-29, UST recommends cytology alone every 3 years, HPV co-testing every 5 years, or HPV testing alone every 5 years becomes an option starting at age 30, since HPV testing in younger women has lower specificity due to high rates of transient infection. The 20-year-old woman presents with a thick, white cottage cheese-like vaginal discharge in vulvar pruritus. Vaginal pH is 4.0, and microscopy reveals branching pseudohyphae. Which of the following is a known risk factor for this condition? A. Copper intrauterine device use. B. Recent antibiotic use. C. Recent condom use. D. Is sexual abstinence. Undefined vaginal pH above 4.5. The correct answer is recent antibiotic use. Recent antibiotic use disrupts normal vaginal flora and predisposes to overgrowth of Candida species, causing vulvovaginal candidiasis, which presents with thick discharge, pruritus, normal to low pH, and pseudohyphae on microscopy. This condition is characteristically associated with a normal acidic vaginal pH rather than an elevated one. At what age should routine screening for lipid disorders, dyslipidemia, typically begin in men without known cardiovascular risk factors? Per general preventive guidelines. A. Age 20. B. Age 35. C. Is age 50. D. Is age 65. The correct answer is age 35. Guidelines generally recommend beginning routine lipid screening in men at age 35 in the absence of additional cardiovascular risk factors. Screening may begin earlier, around age 20-25, if risk factors such as diabetes, smoking, or family history are present. A 58-year-old man with long-standing hypertension develops left ventricular hypertrophy on the cellular level. Which of the following best describes the primary mechanism of myocyte enlargement? A. Increase in the number of myocytes through mitotic division. B. Increase in the size of the individual myocytes with increased protein synthesis. C. Replacement of myocytes with fibrous connective tissue. D. Accumulation of lipofuscin pigment within myocytes. Undefined differentiation of myocytes into fibroblasts. The correct answer is increase in the size of the individual myocytes with increased protein synthesis. Cardiac myocytes are terminally differentiated and cannot proliferate in response to increased workload. Instead, they undergo hypertrophy, an increase in cell size driven by increased synthesis of sarcomeric proteins. Hyperplasia or mitotic division is not possible in permanent tissues like cardiac muscle. A 24-year-old woman presents with acute onset severe right lower quadrant pain, nausea, and vomiting. Pelvic ultrasound shows an enlarged right ovary with absent venous flow on Doppler. What is the most likely diagnosis? A. Ectopic pregnancy. B. Ovarian torsion. C. Pelvic inflammatory disease. D. Ruptured ovarian cyst. Undefined tubo-ovarian abscess. The correct answer is ovarian torsion. Acute, severe, unilateral pelvic pain with an enlarged ovary and absent venous flow on Doppler ultrasound is classic for ovarian torsion, a surgical emergency requiring prompt detorsion to preserve ovarian viability. A ruptured cyst would typically show free fluid without the vascular compromise seen here. A patient undergoing hip surgery has an anteriorly dislocated hip reduced. Postoperatively, weakness of hip adduction and sensory loss over the medial thigh noted. Which nerve was likely compressed? A. Obturator nerve. B. Femoral nerve. C. Sciatic nerve. D. Lateral femoral cutaneous nerve. Undefined pudendal nerve. The correct answer is obturator nerve. The obturator nerve passes through the obturator foramen close to the hip joint and supplies the adductor muscle group along with sensation to the medial thigh. Anterior hip dislocations can stretch or compress it. The femoral nerve instead governs knee extension and anterior thigh sensation. Investigators want to study the effect of a new antihypertensive medication prepared with placebo, ensuring that neither the patients nor the investigators assessing outcomes know which treatment was assigned. This study design eliminates which type of bias? A. Observer measurement bias. B. Selection bias. C. Recall bias. D. Lead time bias. Undefined confounding. The correct answer is observer measurement bias. Double blinding prevents both participants and outcome assessors from being influenced by knowledge of treatment assignment, thereby reducing observer measurement bias in how outcomes are recorded and interpreted. Confounding is instead addressed by randomization and study design, not by blinding. A patient presents with the following arterial blood gas parameter value: normal, pH 7.3, 07.35 7.45, par CO2 60 mm, Hg 35-45, HCO3 29 m, L22 26. Which acid-base disturbance is present? A. Respiratory acidosis with partial metabolic compensation. B. Metabolic acidosis with respiratory compensation. C. Respiratory alkalosis with metabolic compensation. D. Mixed metabolic and respiratory acidosis, undefined, acute, uncompensated respiratory acidosis. The correct answer is respiratory acidosis with partial metabolic compensation. The low pH with elevated part CO2 indicates a primary respiratory acidosis, and the elevated bicarbonate above normal reflects renal compensation via increased bicarbonate resorption and generation, though the pH remains acidotic, indicating only partial compensation. A primary metabolic process would show bicarbonate as the initiating abnormality rather than a compensatory response. A 2-month-old infant is brought to the office for her first routine health maintenance examination and for her immunization update. Today, the patient is due for her first diphtheria, tetanus, pertussis, DTaR-P vaccine. Which of the following historical factors is most important to obtain prior to administering the vaccine? A. Formula intolerance. B. Gestational age at birth. C. Household smoking. D. Pets in the household, undefined, previous seers. The correct answer is previous seizures. A personal history of seizures or progressive neurologic disorder is an important consideration before administering pertussis-containing vaccines, since it affects the risk-benefit discussion and vaccine choice. The other listed factors do not significantly affect the decision to vaccinate with DTaR-P. A 26-year-old woman presents to the office with a 5-year history of intermittent headaches that occur once or twice a week. She currently has a headache and rates the pain as a 5 on a scale of 0 to 10. The patient describes the headaches as throbbing pain on the right side of her head. At its worst, the pain is a 7 on a scale of 0 to 10. The episodes are accompanied by nausea and malaise. Loud noises and strong odors worsen her symptoms, but sleep and ibuprofen alleviate her symptoms. Physical examination reveals internal rotation of the right temporal bone, compression of OA on the right, C6 extended, rotated right, segment right, no tenderness at C1, C3. What type of headache is this patient most likely experiencing? A is cervicogenic, B a cluster, C a migraine, D rebound undefined tension. The correct answer is migraine. Unilateral, throbbing headache with associated nausea, phonophobia, and osmophobia, relieved by sleep, is classic for migraine. The absence of cervical spine tenderness, no tenderness at C1, C3 argues against a cervicogenic cause, despite the incidental somatic dysfunction findings. A new screening test is evaluated against a gold standard biopsy in 1,000 patients, disease present, disease absent, test positive 180-20, test negative 27-1080. What is the sensitivity of this screening test? 8, 90, B, 97.5, C, 97.5. Specificity, not sensitivity, D, 8, 18. The correct answer is 90. Sensitivity equals true positives, false negatives equals 18,018,020 equals 180,200 equals 90. Specificity, calculated as 78,078,030 equals 97.5, is a separate measure describing the test's ability to correctly identify those without disease. Which statement best describes the mechanism of intestinal glucose absorption at the apical membrane of enterocytes? A. SGLT1 co-transports glucose with narrow down its electrochemical gradient using energy indirectly from the archaic pace on the basolateral membrane. B. GLUT2 actively pumps glucose against its concentration gradient of the apical membrane. C. Glucose diffuses passively across the apical membrane independent of sodium. D. GLUT5 co-transports glucose with sodium at the apical membrane. The correct answer is SGLT1 co-transports glucose with narrow down its electrochemical gradient using energy indirectly from the archaic pace on the basolateral membrane. SGLT1 is a secondary active transporter that brings glucose into the enterocyte alongside sodium, moving down its gradient, a gradient maintained by the basolateral archaic pace. Glucose then exits basolaterally via facilitated diffusion through GLUT2. GLUT5 instead is the apical transporter for fructose, which moves by facilitated diffusion rather than sodium-coupled transport. A 48-year-old woman avoids grocery stores, public buses, and standing in lines because she fears having a panic-like attack in a situation where escape would be difficult or embarrassing. She now needs a family member to accompany her whenever she leaves home. She denies discrete panic attacks. Which of the following is the most likely diagnosis? A. Agoraphobia. B. Generalized anxiety disorder. C. Panic disorder. D. Separation anxiety disorder. Undefined social anxiety disorder. The correct answer is agoraphobia. Marked fear or avoidance of two or more situations, such as public transportation, open spaces, or crowds, due to fear of difficulty escaping or being unable to get help, defines agoraphobia, which can occur with or without co-occurring panic disorder. A study reports that a new drug reduces the relative risk of stroke by 40, but the absolute risk reduction is only 0.4, because the baseline stroke rate in the study population was very low. Which of the following best explains why relative risk reduction can be a misleading way to communicate this benefit to patients? A. It can exaggerate the perceived benefit when the baseline risk is low. B. It cannot be calculated when baseline risk is low. C. That always understates the true benefit of treatment. D. That is only valid in case control studies. Undefined, that eliminates the effect of confounding variables. The correct answer is it can exaggerate the perceived benefit when the baseline risk is low. Relative risk reduction remains constant regardless of baseline risk. So, when baseline risk is low, a large relative reduction can correspond to a tiny absolute benefit, misleading patients about the true magnitude of effect. Absolute risk reduction and NNT better convey the real-world impact in such situations. A resident is criticized harshly by an attending during rounds. Later that day, the resident snaps at a medical student over a minor error. Which defense mechanism best describes the resident's behavior? A is displacement. B. Projection. C is sublimation. D. Reaction. Formation. Undefined. Regression. The correct answer is displacement. Displacement is the redirection of an emotional response from its original, often threatening source, the attending, onto a safer, less threatening target, the medical student. Projection would instead involve the resident attributing his own unacceptable feelings to someone else, not redirecting the emotion itself. A 63-year-old woman presents with substernal chest pain for 1 hour. ECG shows 2 mm ST segment elevation in leads V1, V4. The nearest catheterization laboratory can have the patient on the table within 60 minutes. Which of the following is the most appropriate management? A. Primary percutaneous coronary intervention. B. Fibrinolytic therapy immediately. C. Serial troponins every 6 hours before deciding. D. Stress echocardiography. Undefined discharge with outpatient cardiology follow-up. The correct answer is primary percutaneous coronary intervention. When timely PCI daughter balloon time within about 90 days and 120 minutes is available. Primary PCI is preferred over fibrinolytics for STEMI due to superior outcomes and lower bleeding risk. A rib fracture at the inferior border of a rib is most likely to injure which neurovascular structure, given typical intercostal anatomy? 8. Nothing significant. The intercostal neurovascular bundle runs along the superior border, protected in the costal groove. B. Intercostal nerve indicals, which run along the inferior border. C. The internal thoracic artery. D. The azygos vein directly undefined to the thoracic duct. The correct answer is nothing significant. The intercostal neurovascular bundle runs along the superior border, protected in the costal groove. The intercostal neurovascular bundle vein, artery, nerve from superior to inferior runs in the costal groove along the inferior border of each rib, which is why clinicians place needle tubes just superior to a rib's lower border to avoid injury. A fracture at the inferior border is therefore more likely to injure these structures than one along the superior border. This anatomic detail is the basis for the standard approach to thoracentesis. A new screening test detects a cancer earlier than previous methods, and patients screened with a new test appear to survive longer from the time of diagnosis, even though the disease's natural course and time of death are unchanged. This phenomenon is best described as A. Lead time bias, B. Length time bias, C. Attrition bias, D. Recall bias, undefined confounding bias. The correct answer is lead time bias. Lead time bias occurs when earlier detection simply increases the observed time between diagnosis and death without truly extending survival, creating an illusion of benefit from screening. Length time bias instead refers to screening preferentially detecting slow-growing, less aggressive disease, which is a distinct phenomenon. Freyet's first principle describes somatic dysfunction of a group of vertebrae in a neutral spinal mechanics position, in which side bending and rotation occur to A. the same side at a single segment, B. the same side across multiple segments, C. opposite sides at a single segment, D. opposite sides across multiple segments, undefined opposite sides regardless of segment number. The correct answer is opposite sides across multiple segments. Freyet's type I mechanics occur in a neutral end spinal position, involve a group curve across multiple vertebral segments, and produce side bending and rotation to opposite sides. Type II mechanics, Freyet's second principle, occur in a non-neutral flexed or extended position at a single segment with side bending and rotation to the same side. A screening test tends to preferentially detect slow-growing, indolent tumors during periodic screening intervals, while fast-growing aggressive tumors are more likely to present symptomatically between screenings and be missed by the screen. This phenomenon that can make screening appear more effective than it truly is called a length time bias, B. lead time bias, C. recall bias, D. healthy worker effect. The correct answer is length time bias. Length time bias arises because slower progressing tumors have a longer asymptomatic detectable period and are thus more likely to be caught by periodic screening, which inflates the apparent survival benefit of screening compared to more aggressive, rapidly fatal tumors that are missed by screening intervals. Which of the following is the treatment of choice for severe, life-threatening digoxin toxicity with hypokalemia and ventricular epitheliars? A. Digoxin-specific antibody fragments digibind. B. Calcium gluconate alone. C. Increased oral potassium supplementation. D. Atropine undefined sodium bicarbonate. The correct answer is digoxin-specific antibody fragments digibind. Digoxin immune fab fragments bind free digoxin and remove it from circulation, rapidly reversing toxicity, and is the definitive treatment for severe digoxin toxicity. Calcium administration is relatively contraindicated in digoxin toxicity due to concern for worsening cardiac excitability stone heart. A 62-year-old man presents with left lower quadrant pain, fever, and a palpable tender mass. CT scan reveals thickened sigmoid colon wall with pericolonic fat stranding and a small abscess. What is the most appropriate initial management? A. Emergent sigmoid colectomy. B. Immediate colonoscopy. C. Referral for antibiotics with possible percutaneous drainage. D. Oral antibiotics and outpatient follow-up only undefined surgical resection with primary anastomosis regardless of abscess size. The correct answer is for antibiotics with possible percutaneous drainage. Complicated diverticulitis with a small abscess is typically managed with Roman IV antibiotics and percutaneous drainage if the abscess is large enough, generally 3-4 cm, reserving surgery for failure of conservative management, free perforation, or peritonitis. Colonoscopy is deferred until the acute inflammation resolves due to perforation risk. How many did you get right? Let us know in the comments and tell us what topics you want us to cover next. Want to practice more? Download the app and get hundreds of free practice questions with detailed explanations.